Hi everyone, Dr. Pam here. I've been offline the past couple months. I had an injury happen and I've been spending quite a bit of time healing myself and just resting. So today what I want to talk to you a little bit about is gluten sensitivity. And I have oftentimes patients come in that have been avoiding gluten sometimes for like 3 to 4 years, and they're still symptomatic, they're still having issues, and they're not exactly sure what the trigger is. And one thing that a lot of people are not aware of is that there are a lot of other places out there that you can have gluten exposure that you may not necessarily have thought about. As many of you know, I've talked in some of the previous videos, we've started doing some stool testing this past year, and on there's an anti-gliadin marker. So we can see if somebody is actually reacting to gluten in the stool test. And it's been shocking actually to see how many people do react to that have gluten issues. And as I said, oftentimes most of them have been avoiding it for a couple of years. So how can this happen? What's happening here? There's a good article that I'm going to put an attachment to underneath this video that you might want to read, and it talks all about gluten cross-reactive foods and then other sources of gluten. But gluten cross-reactive foods are foods that can actually mimic a gluten response even though they are gluten-free. And that is probably one of the most frustrating things is most of these things on this list are actually gluten-free grains. So when you have somebody that has taken gluten out of their diet and they're maybe eating some gluten-free grains and including a little bit of those, unfortunately they still may be reacting to them. So what I want everyone to do is to look at this article, and maybe it'll stimulate some ideas. If you're still struggling with gluten, you might think, oh, I've been having a lot of quinoa and maybe that actually is what I'm reacting to. Or other places that you might be getting gluten exposure, like your makeup, your shampoo, even soaps, receipt paper. I had no idea that there actually is gluten in that. And sometimes you feel like I need to go live in a bubble. That's how I feel when I read the list, like, oh my gosh, is there any place that's not safe anymore? And look at this just for information. This isn't to make you overwhelmed. It's not to make you feel depressed that throw your hands up, there's nothing that you can do. But it's to educate you as to why you might still be symptomatic, and then get you to look at maybe some other areas that you might be able to remove some things to help with some of your symptoms. But as always, in the way that I view this, if somebody is that sensitive and they're reacting to a lot of foods or environmental things, I keep going back to the gut. There's something going on in the gut because that's where most of the immune system is, and we have to dig a little bit deeper to figure out what some of the triggers are that may be stimulating some issues happening in the gut. And if you can get the immune system healthier in the gut, what you will find is that you become less and less reactive over time. And so hopefully avoiding a lot of these foods is not a lifetime sentence to where you can't ever have them again, but temporarily, maybe for a few weeks, it can be helpful just to get rid of some of that inflammation that's in your body. So hope to catch you all in the next couple of weeks. I'm going to be doing a little segment on traditional farming and educating people about what kind of happens in this country with conventional farming as to why many of us have problems with wheat, and in other countries they don't. Have a great weekend and happy holiday.